I'm Denise.
I'm Katie.
I've been friends with Katie for over 20 years.
I cannot believe it's been 20 years.
This is
88 Chat,
where we talk about a really random program. All right, so the topic today is health insurance. I'm for Medicare for all.
Yes, I agree. I would like that very much. It's hard to find the words actually to talk about it because it's been such an ongoing topic for so many people that I think I have just a lot of frustration.
Our health insurance sucks. It just does. Most of us can't go to the doctor without putting ourselves into debt or try to get a free clinic close by. So we are in one of the states where single payer legislation has been introduced from 2010 to 2019.
Mm-hmm.
So we have had possibly on our books. So I guess we're just waiting to see, because I think the legislations have been on hold with this virus. We have to figure out this pandemic first. But at least we're talking about it and trying to push forward with it.
Yeah, it has affected so many people. So many people have been and still are in the hospitals for these long stays. And once the emergency level theoretically goes down, then all of those people are going to have to pay back those medical bills. That's a lot of people, likely with a lot of debts. So I wouldn't be surprised if it caused some kind of economic issues when that amount of people are all continuing to live in that much medical debt. I think that it will come to a head at some point in our near future. Darn you, capitalism. That's what it all just comes down to. It's our system is so locked into making money for the people who already have it and sucking the rest of us completely dry. And I definitely don't think that it's fair or appropriate to bankrupt people for their health. It's nobody chooses to be sick. Nobody wants to have health problems. It's not something that anybody, it's not something you put in your 5-year plan for your life. And especially now, while we're in a pandemic, I think I just get frustrated by the whole thing.
I think for me, like I'm same with you. I'm set with health insurance for all people. Mine was completely selfish reasons, because I can't really afford not to have healthcare or health insurance because of my asthma, my liver, whatever other body parts is falling apart right now. Because if I'm going from one job to another job, I have to wait like at least 2 months before I get another health insurance. And in those 2 months, I cannot get sick because I cannot afford going to the doctors.
Anyone who has chronic illness of any kind knows that it's already enough of a full-time job just managing your health and coordinating health between multiple doctors, multiple medical appointments in a month or in a week or in a day. That's enough work for you to have to deal with without having them constantly calling you and saying, oh, hey, this new medication is really expensive. Are you sure you want to take that? If you're sick, and then having to barter or bargain or do what any of the kinds of things people have to do to get access to the care that you already know you need. You already know you need it. So there's no benefit in your insurance company saying, this is kind of expensive. I had that conversation with my mom many times where she'd say, yeah, I know it's expensive. I still have to take it or else I'm going to die. So I guess I'm going to pay for it. It's just not a great situation to see people having to be put in. And when you really do have to, in our current situation, decide, do I want to drain my pockets for a little more time or have less lifespan, less time with my family to live a little bit cushy in that shorter lifespan? And it's just not fair. It's just not.
For me, I always have to have insurance because I have a brain aneurysm in my head. No, it has not been taken care of. They are washing it. So every single time I go to a new job, I have to make sure my health insurance covers my neurosurgeon. I have had this neurosurgeon for 5 years. I have to make sure of that because he has the records of what's going on in my head. I mean, I'm scared because it is aneurysm and it's like a bomb that you don't know if it's a dud or if it's gonna detonate. So for me, like, not only do I have to worry about the thing in my head, I have to worry about expenses. Last time I did a cardio angiogram, the total cost without health insurance was $40,000.
Wow.
And then after health insurance, it was $7,000.
Still a lot.
It's a lot of money. I don't make that much. So I'm like, I can't pay that. Even the minimum payment, monthly payments, I still can't afford that.
It's not fair for any person to be in that kind of situation where you literally cannot afford your health.
If I'm in a really bad situation where I lose my job, I get furloughed, like what's been happening right now, the one thing I don't want to worry about is health insurance. It makes me want to move out of the country just because other world countries that are like on the same level as us, they all have universal health care. Then people say Venezuela, Venezuela.
Yeah, people do use that a lot. There was an article that I read recently that was talking about someone who had been shot multiple times. And because the hospitals were so overrun with COVID patients, this, I think, was a guy, was in the hospital for like a week and never even ended up having the surgery to have the bullets removed because they were so overrun run in the hospital. So something that would have normally gone to ER happened right away. It was extended for longer, which she had no control over. And then my mind immediately went to, well, that's 7 extra days worth of hospital bills, which would definitely bankrupt the average person. So when you have no control over your health, you have no control over how long the hospital's going to keep you, and then they slap you with this gigantic bill that you now are quote unquote given control over, you have really no say in that kind of situation, and that's just a huge problem. So if we had universal health care, that such a huge weight would be lifted off of so many people, working people, people with disabilities. I mean, the range of who it could help is so astronomical. I don't think that I could possibly understand there being an other side, because my mindset as a person is always thinking about people first. So I don't understand why capitalism is more important than people.
People think that I don't want them to pick my doctors. Like, they're not picking your doctors.
If you have insurance the way that we have it now, you have limitations based on whatever your employer picks for you, whatever health plan you have is telling you which medical centers you can go to, which procedures you can't have, which medications you can and can't have. So we already are living under those kinds of restrictions as it is.
For me, the best way for me to explain to somebody is, I think I told you this before, is to say like, hey, let's say I'm taking you out to eat. I tell you that you can pick wherever restaurant you want, and I will pick up a tab. It doesn't matter how expensive it is or anything like that. So basically, I'm basically the government. I am paying for your food. I told you you can pick wherever you want. I will not conjecture. I will not say a thing. I will not hop on whatever person you want to pick or whatever place you want to pick. We'll go there and eat. The restaurant is your doctor or the hospital or the clinic. They can sometimes be fancy and sometimes they can be a quack and horrible. But if you prefer it, it doesn't matter to me. I'm just the one picking the tab. And the only thing you need to do is leave the tip. That's it.
Right, and that would be the copay.
Yeah. A copay, yeah. And that's it. You get to choose.
That's a good comparison.
I mean, there's also a main complaint of the wait time. The wait time is going to be the same either way, whether or not it's government healthcare or not. You still have a lot of people that are sick. That means more people are going to go to doctors. That part is not going to change.
Yeah.
The only thing that does change is that more people are able to go to doctor. People get to be healthier, and we have a longer lifespan. And that means longer times with your families, your loved ones.
I have no shame in appealing to people's soft side in that case. When people are often complaining about homeless or low income people, they always make this argument that they're not bettering themselves because of health insurance or whatever. And my thought is, could you really blame them? I mean, if the only way that you have access to your doctor is if you don't get a better job, that is not the fault of the person who is stuck in that situation. They're stuck. It traps people in bad situations so that they can maintain access to their doctors.
Even with a Medicare for all, you can still get a secondary insurance if you want to. Just add that extra cover, extra cushion, or whatever. Most people just choose one because it's easier to think about. But it's up to people. Me, I probably add in a little cushion in there just in case. But still, Medicare for all has worked wonderfully for almost all the other countries. I know people say, well, we're not them. Of course, we're not them. But remember, we are a fairly young country compared to others. I'm pretty sure they've gone through the same stuff as we had. But I mean, it's just better for all of us, all around. Medicare for all is better just in general because for me, when I go to doctor, I want them to focus on me, not, and I want to focus on me as well to explain what's going on with my body and how much it's breaking down. I don't want to worry about another bill that I have to pay. If I don't want it, why would I want to put it on somebody else? If doctors don't have to worry about how they're going to get paid, if it's just all government, then they can be more focused on their patients. I'm hoping that we will eventually see it in our lifetime. I'm hoping, I'm praying that we will. The question is whether or not how we're going to get there.
Healthcare is a human right. If you can't pay for it, then your rights are being infringed upon in that way. So I don't really even have a way to wrap that up. That's just kind of a blanket statement, and I'm putting it out there into the ethos. That's what I think, and you can sit with that.
I hate to put this around against our supporters. I don't want to say any hate to you, but we are very liberal. We live in a liberal state, so this might not be the channel for you.
Yeah.
But that was a good discussion. If you like my explanation for Medicare for all, thank you for taking my analogy. I think we're gonna end this conversation here because we're both in agreement.
Thanks for watching this episode of 88 Chats. If you enjoyed this video, don't forget to like, subscribe, and leave a comment.
Now